I mean, you look fantastic.
Better than when we met, right? Do you think? I think I can see it. You're okay, you don't have to say that, but I think stem cells really made a difference. Although I'm ready for more, but my budget is not ready. But my body wants more. But you know, we're trialing, airing different things to see like what does exosomes do in isolation. I actually like found them to be. I felt so fatigued after doing solo exosomes, and you know, so many factors to say. But I think that like viruses play a role in that, and like you were talking about the NK cell immune system relationship, and it's very variable, right? The response that people can. Oh, I wanted you to talk about other BII patients, because I think people who are listening might be, because people have asked me about stem cells and BII specifically, and I've given...
the breast implant, I can't really say I've treated people with the, you know, I can't say that's breast implant, you know, produced problems. I mean, I've helped people who, before they were doing surgery, these are actually fat transfers. They were going to transfer fat to the breast, because that's another method, right? They think is more natural, but a lot of times the newly transferred fat don't really survive. So
like the necrosis, or just
no,
losing
they've been changed from one place to another, and you know, you'd be lucky if a third of them are still there, you know, by the time it's, you know, a month or two down the line. So so I was giving patients stem cell pre-treatment, so to give their body enough of these regenerative potential, and that really enhance the retention of these cells after they got the fat transplant.
So was that an infusion and an IV, or you were doing local injections of stem cells?
No, I was just doing an infusion.
Oh, wow.
Because I do believe that you want the cells to talk to your immune system, and that's one of the most pivotal power of these cells, is that they are asking your immune system to come and participate, to help with removal of the bad cells and regenerating new cells.
And so with my understanding of the way like an injury in the immune system works, I would imagine if you just had a surgery in this area, it's almost like telling the immune system like to hyper focus on that area. So if they're going in anyway, they might just be like pulling that fat out too, thinking it's inappropriate. And so I could see how that would, you know, dampening that with stem cells, which are really anti-inflammatory, could lead to kind of like a more balanced integration of that fat, right? So that makes sense to me.
Yeah, the survival of the cells, the new cells, you know, it requires certain nurturing environment, so more regenerative environment. Without that, they probably would just wither. It's like, I don't belong here, you just suck me out of my, you know, my thigh, and then now I'm in the breast, so why should, you know, like they got traumatized, and then they go on to die. And stem cells, one of the benefits or function of mesenchymal stem cells is anti-apoptotic property, which means if the cells are damaged, they think they should die, they are able to send signals to prevent that programmed cell death pathway. So it really, you know, kind of halts them on their path to die. So then you're retaining more live tissue.
So how does that work? That's really interesting. I haven't heard that particular point. So how does that work in relation to like the apoptosis that you want to happen with senescent cells? Like
that's completely different pathway. I mean, that's the magic of stem cells, and that's something that, you know, why I'm always in awe, you know, when I treat patients, because the cells know when it's cancer cells, when the cells don't belong, there's something really wrong with the cells. These mesenchymal stem cells are able to send signals to trigger them onto apoptotic pathway. They secrete what's called trail ligand. So that actually kind of lights up that pathway, so then they go down and die. But when the cells are semi-damaged, but really could be salvaged, like let's say you got a burn, or you know, some kind of mechanical damage, some kind of radiation damage, or even ischemia in stroke victims, the area that got damaged, they die, you know, that severe damage. But then they would leak out all these calcium, all these signals, and the neighboring cells would also all of a sudden decide, okay, I think, you know, it's time for me to die.
Oh, wow.
But in those cases, the mesenchymal stem cells are able to say, no, you don't have to die. You know, you don't qualify.
Interesting.
So, and then they are able to save save these neighboring cells so you don't have to have massive lesions.
Right. Isn't it so interesting? And I know you have a background in psychology, or psychiatry rather,
Yes.
one of your diplomates. I think it's so phenomenally interesting how on the local, like, cellular level we see these parallels to just our social interaction in life, right? Right?
Yeah, intelligence. And that's
Right.
what I call, so that's true, you know, the bigger universe and the little universe, we are, you know, literally a
Reflections,
universe.
yeah.
We're walking around with all these, you know, what 90% of our genetic material are, you know, microbes, right? So we're this walking universe. So when the cells, when they are senescent, and when they get older, they lose certain intelligence, and that happens to stem cells as well. So I coined the term cellular dementia. So these cells, you know, your stem cells are getting demented because when you put fat-derived stem cells, which is from an adult person, you know, 40, 50 years old, years of age, they have lost some of the intelligence that were still contained in the early cells, you know, compared to when the baby is really young, or in the birth tissue, which is way younger than the baby's stem cells. When you use those really early cells and you put them next to cancer cells, they've done this in research studies, the birth tissue derived MSCs next to this brain cancer cell, glioblastoma, they're able to kill off the cancer cells, make them shrink and go away. But if you got fat-derived MSCs and put them next to these cancer cells, it helped them grow. They just get bigger and bigger.
No way.
So that's the cellular dementia.
So you're saying, so this, I'm so sorry to interrupt you. I just got excited. I got so excited. So finish.
It is exciting, yes.
I wanted to know, because I've heard that in the people who criticize stem cells, that they say they can drive cancer. And
Yeah.
so, yeah.
Well, because, I mean, watch my YouTube video.
Yeah.
Are all MSCs created equal?
I think I've seen that one.
Yeah, they're not,
a good one.
because stem cells from a birth tissue, which is kind of in between the stem cells from the newborn baby and the embryonic stem cell, they're kind of sitting in the middle because they got surface receptors that are very similar to embryonic stem cells that you just don't find in the stem cells in the baby anymore. So they're kind of in between because they got sequestered and you know they got cornered off in very early in the embryogenesis process.
Okay.
So these young cells have all this powerful intelligence that have gradually been lost as we get older and older. So it just, you know, it's...
So when people are trying to decide what type of stem cell infusion they need for their health, you're saying the older the patient is, if they're thinking about an adipose or even a bone marrow, which I would never do, but I know people do that, right?
Yeah.
You're saying maybe think more about getting...
Yeah. Well, I'm a big proponent of birth tissue-derived stem cells because my mission is to give people the most powerful form of therapy, right? The most beneficial results, and then the least chance of problems, of harm. So the best, you know, if you watch that lecture, it gives you all this research studies looking at the evidence of the potency between these different cell types and the safety.
Right.
So there's really no equivalence that, you know, there's no confusion that these birth tissue derived stem cells are more potent and more powerful and are safer. So I wouldn't do it on myself, and I don't want to do it for a patient, especially, and I think if a person's over the age 50, 55, I really think they're just way better off if they just use a birth tissue derived stem cells.
Got it. Okay.
And besides, you know, you may be using this for more of, you know, helping with your health and the condition that you're dealing with, but I'm sure part of it is also you using it for anti-aging purposes.
Oh, absolutely,
right?
Absolutely. Well, because I feel like toxicity took away a lot of my youth and, you know, aged me more than... Well, I know I have an aging gene, an SOD2 gene.
I see.
So, you know, I want to get it totally downregulated, but when it was really active in my... I mean, there's no way to know for sure.